A healthy and satisfying sex life is essential for our overall well-being and happiness. Sometimes, medical issues can get in the way, and that's where the right medications come into play. In this video, we'll be discussing some of the best medications that have actually been proven to be useful and effective in boosting your sex life and can help enhance your intimate moments. If you like what you see here, please subscribe. So, before we jump on to the medication tips, I will strongly recommend that you should see this video because you should all aware of those common drugs that are affecting your performance in bed and you don't even know. The link will be available in the description down below. So, tip number 1 is to reduce the dose of your medication. If you're taking antidepressants, then you need to reduce it down to half. There was a study that showed that cutting the antidepressant dose in half improved treatment-emergent sexual dysfunction in 75% of cases. And in those who stopped their medication altogether, they had total recovery after a few days or weeks. Now, this strategy should only be used in those who have already achieved full remission on their medication because lowering the dose obviously carries some risk of your symptoms returning or worsening. So, I'd suggest to find an alternate way to deal with your depression. And if you're someone who just started a medication or still having symptoms that you're trying to get under control, you may want to consider tip number 2 and 3 that I'm just going to discuss. Tip number 2 is to add a helper medication. Now, there are 2 medication strategies that have been proven over and over again to have a clear, statistically significant benefit when it comes to reversing sexual side effects from antidepressants. The first is adding on bupropion or Adwell-Butrin to your medication regimen. And this is one of the effective approach because it can give you a triple whammy effect. And this is helpful for both men and women. It helps in improving sexual side effects. Second, increases sexual desire and improves overall sexual functioning. And third, it enhances treatment of your depressive symptoms because bupropion itself is an antidepressant medication. If this approach is something you're interested in, then one thing you should know about, so that you can bring it up to your provider, is that lower doses of bupropion might not be as effective as higher doses. By the way, vilazodone also falls in this category. According to a study, some people saw benefit with lower dosing. There have been other studies conducted that have not shown improvement of sexual side effects at doses of 150 milligrams daily. When we're looking at the extended release version of bupropion and vilazodone, the doses that we want to be using are 300 milligrams to 450 milligrams daily. The next medication strategy that has a ton of evidence supporting it is the addition of PDA5, a phosphodiesterase inhibitor, to your medication regimen. So these would be things such as sildenafil or tadalafil, also known as a Viagra and Cialis. Viagra is perhaps one of the most well-known medications for enhancing male sexual performance. The Journal of Clinical Psychiatry came out with a randomized controlled trial looking at men who developed erectile dysfunction while taking an antidepressant, and they found that those who were on sildenafil had improvements in both erectile dysfunction and overall sexual satisfaction. Cialis is another popular medication for ADA. What sets it apart is its long-lasting effect, often referred to as the weekend pill. It can provide relief for up to 36 hours, giving you more flexibility in planning your intimate moments. Now, when comparing sildenafil head-to-head with tadalafil, what you're going to see is that sildenafil is the best-studied phosphodiesterase inhibitor. However, if you're someone who wants some spontaneity in your sex life, tadalafil is a great option because, as I told you, its effects last up to 36 hours. The recommended dose of tadalafil is 5 to 20 mg 30 minutes to 36 hours before sex, where sildenafil is 50 to 100 milligrams 30 minutes to 4 hours before sex. Okay, so there are 3 other helper medications worth mentioning that are commonly used that don't have quite as robust evidence supporting them. However, people have reported benefit from them, so there are options I want you to know about. The first is Dapaxtine. Dapaxtine is a medication specially designed for men used to address premature ejaculation by increasing the time it takes to ejaculate during sexual activity. Typically, Dapaxtine is available in 30 mg and 60 mg tablets. The usual starting dose is 30 mg, taken 1 to 3 hours before anticipated sexual activity. Second is mirtazapine or Remeron. There is a retrospective study showing that people who took 15 to 45 milligrams of mirtazapine, in addition to their primary antidepressant, had improvement in sexual side effects. However, there is yet to be a randomized controlled trial supporting this strategy. The third helper medication that I want you to know about is buspirone or Buspar. There was a placebo-controlled trial that showed it was helpful in improving sexual side effects caused by paroxetine or citalopram. These effects were more pronounced in women than in men, and dosing for this medication is between 15 to 60 milligrams daily, and this is usually divided into twice a day or 3 times a day dosing. Thank you for watching. If you found this video informative, please hit like bell icon, subscribe, and share with the ones you care.